How do doctors diagnose T-cell lymphoma? Imagine feeling unusual symptoms like swollen lymph nodes, skin changes, or unexplained weight loss. These signs can be caused by many conditions, but when they persist, doctors need to investigate further. Diagnosing T-cell lymphoma begins with a detailed medical history and a physical exam. The doctor will check for enlarged lymph nodes, skin lesions, or other abnormalities that might suggest lymphoma. The next step usually involves a biopsy. This is the most important test for confirming T-cell lymphoma. There are different types of biopsies. The most common is an excisional biopsy, where the doctor removes the entire lymph node or a part of it. This allows the pathologist to examine the tissue closely under a microscope. If removing a whole lymph node isn't possible, a needle biopsy may be done. This uses a hollow needle to extract a small tissue sample. For skin-related T-cell lymphoma, a skin biopsy is performed by taking a small piece of affected skin. In some cases, doctors also perform a bone marrow biopsy. This involves taking a small sample of bone marrow, usually from the hip bone, to see if the lymphoma has spread there. For skin lymphomas, a skin biopsy helps identify malignant T-cells in the tissue. Once tissue samples are obtained, laboratory tests help classify the lymphoma. Immunophenotyping uses special techniques like flow cytometry or immunohistochemistry to detect specific markers on the surface of the lymphoma cells. Markers such as CD for CD8 and CD30 help determine the exact subtype of T-cell lymphoma. Molecular studies, like T-cell receptor gene rearrangement tests, check for clonality, confirming whether the T-cells are malignant. Blood tests can sometimes detect abnormal T-cells circulating in the bloodstream, especially in certain types of T-cell lymphoma. Imaging scans like PET-CT or CORT scans are used to see how widespread the disease is, revealing enlarged lymph nodes or extranodal involvement. If there's suspicion that the central nervous system is affected, a lumbar puncture may be performed to analyze cerebrospinal fluid. Because T-cell lymphomas can look like other benign conditions and have many different forms, doctors often need to combine several tests to make an accurate diagnosis. The biopsy remains the gold standard, supported by immunophenotyping and molecular analysis to identify the specific type of lymphoma. This thorough approach helps ensure the right treatment plan is created. If you or someone you know is experiencing symptoms that could be related to lymphoma, it is essential to consult healthcare professionals who specialize in lymphoma diagnosis and care.